All right, y'all. Hopefully, because I'm sitting in a different area, hopefully everything looks okay. But you know, I check when you're on my lives. I got to check a couple things. So let me look real quick. All right, let's see. Refresh. My MacBook is really loud today, this fan. So if you can hear it and it's really loud, I'm sorry. Okay. So in my live, hold on 1 second. We believe in a future where. So in my life, 2 weeks ago, I asked for, comments of what this next live should be because I do a live every other weekend, and workplace bullying was one, and I wanted to really dive deep into if you've been um, if you encountered any type of workplace bullying. I know for me I have, and I'll share a story. If you want to share stories in the comments, feel free to do so. Let me check one more thing. Okay, perfect. You can hear me. So, what I will say is, of course, oh, y'all know the routine. If you've been following me, you've been watching my lives, give your girl a like. Okay, make sure you're subscribed, especially if you've already been listening to me. My face looks familiar on YouTube. It's okay to subscribe to the channel. It's okay. And thank you in advance. So, this workplace violence, that I believe it was the NP that wanted me to discuss this. For me, I've encountered it multiple times in my nursing career, and it wasn't really violence. It was okay, not workplace violence, workplace bullying. And I don't think I've really, okay, when I was a phlebotomist, nobody really messed with me like that. But when I got into nursing, there were a few bullies. And if you've had any bullies, let me know in the comments right now. Okay, Timmy, hello, Timmy. SK, hi. Raymond, do you have a shutter? Nope. Yes, okay, so I know I'm not the only one. Um, for me, when I did travel nursing, because my last contract was at the beginning of this year. So before that, I did travel nursing for 3 years. I believe I encountered one nurse bully during that. It was a hot mess because she was an older nurse and she calls herself helping me, but she actually was actually going into charts trying to edit what I was doing, and the system that hospital was using wasn't like an Epic or a Cerner. So it was like something old school, and right before I left they were upgrading to Epic, so she couldn't do it. But it was weird because I don't know, have anybody in your career ever edited your documentation? So I was putting in documentation on a patient's port access, where I access the port at, and she would go back and look at what I was doing. Now, we both have a lot of patience, but if you have enough time to look back and check my charting, you're not busy enough. You don't even need me. You could just do everything. But, I was a travel nurse and I was making close to $3,000 a week. So I dealt with that trash, but it was getting to the point where she was getting under my skin and I didn't want to be unprofessional in that setting. So I just went to management, put it in writing, and I had them to talk to her. Ever since then, she didn't even look at me. She didn't even talk to me anymore. She didn't call me, none of that, because she knew she was wrong. And before I was there was other nurses that she intimidated and she got out of there, which is terrible because the job was really easy. The patients were extra sweet and they were oncology patients. So it made it really, really difficult when you're working and there's another nurse that's just breathing down your neck that's not even your manager, that's actually part-time, by the way. So, she didn't mess with me and I end up coming back to that contract. But I didn't do, I wasn't an access nurse then. I worked more in the clinic area with the patients and the doctor. So she didn't bother me then. But a lot of the people knew that when I was there before, they remembered that I was in that, I was the access nurse. So I would access the PICS, ports, trialysis. And if somebody needed labs, the staff would be so afraid to talk to that other nurse because she would give so much backlash. They would come to me and say, hey, can you please access this? I'm like, sure, just give me whatever I need. And, if I needed to discharge a patient, I would say, well, let me discharge this patient and send them to chemo before I take care of yours. And they were fine with that. Okay, let me see. Um, Amanda, hello, didn't realize this was live. Yes, hello, Amanda. I do lives I try to do them twice a month. Usually I do them on the weekends, whether it's a Saturday or a Sunday. I try to do them when my daughter is taking a nap. Usually she'll kind of pop in here and, bombard the video. Because one time she didn't take a nap or the live went too long and her nap was over and I was still talking. But it is what it is. Let's see. Let me see. Slow down in their speech therapy. Raymond. No, I don't stutter though. But no, Amanda, thanks for having my back, but I don't stutter. I kind of talk fast. Um, and I mean, it's okay. I'm not even going to go into that. Let me see. Hello, you ebony cupcake. Hello, Christian. I'm a retail pharmacist and I have a workplace bully. Brenda, tell me about that bully. Please do. I work with a couple pharmacists and, well, these are gentlemen though. They actually go in and they talk to the patients and, these pharmacists are awesome. But, with workplace bullying, it could happen to anyone. Male, female, nurse, pharmacist, customer service rep. It doesn't even matter because some people are they try to be so intimidating. And that's because they're miserable at home. Or somebody else is doing that to them and they want to throw it off on you, which is unfortunate. But Brenda, give me some details about this bully. Is it somebody that works with you? Is it management? Is it somebody you're currently with? Is it somebody that you don't have to worry about dealing with? Have you ever reached out to your manager to see if it can be something to distance yourself from them? And I can tell you about a current story of mine, but I'm gonna keep reading these comments because I don't want to miss too many of them. And if y'all are looking at me right now and y'all haven't liked this video, please do. You already know you can share it if somebody has experienced workplace bullying and they want to talk to somebody. You can talk to me. Okay. Love your videos. Thank you. Thank you so much. Some of these people, they just doing too much. If I skip over your comment, you doing too much. Yes, Amanda, I agree. Okay. So Indian Gaming School, your question is why? Are you saying why? Oh, you talking about my apparel? You probably haven't been watching my lives. This is what my closet looks like. Okay, I've been wearing clothes like this for years. I'm a grown woman, and if it bothers you, I'm sorry, but my husband loves it. I love it because I buy it, and my boutique people that I spend money on for their clothing, of course, love it. So I don't always have to wear scrubs. I can wear other things. I'm in the comfort of my home. But again, if it bothers you, I'm sorry. And you're not the only one that has said something about it. And it doesn't stop me from being me. Okay. Okay, it looks like it's a election up in the comments, which I'm not talking about elections at all. I tend to stand clear of that on my videos because I don't really want to talk politics. Everybody's going to have their own opinion on who to vote for, who not to vote for, and I keep my opinions to myself. But if you want to talk about workplace bullying, nurse bullying, feel free to comment in the description. I'm sorry. Feel free to comment below in the chat box and we can talk. Okay. Let me see. Yes, ma'am. I'm a big fan. You inspire me. Can you help me? I want to be. One day I have loads of no guys. I'm 16 and I've been struggling to find a job. I'm not sure what you mean by hookage. I don't know what that means. You're 16-year-old. You're 16 years old and you're struggling to find a job. What job specifically are you trying to look for? I mean, my kids were working at 16, but they were like retail. So, they were doing like a fast food joint or like a fast food restaurant or a clothing store, department store. Okay. Let's see. Hannah, hi, I'm new to this channel. I love it. Just wondering what's your opinion on. I have no opinion on that at all. Hannah, sorry. Used to work at Taco Bell and had a racist woman. I was 16 and she kept saying that little white girl. I'm sorry you had to go through that, Amanda. You know what? Okay. So, anybody else want to comment something? Okay, people going to get muted because I'm not going to waste my time. Not muted, but you're going to be put on a timeout. I don't want to waste my time on comments that are not really helping this discussion. So if you get muted, sorry, but I don't really want to talk about politics on my channel. With some people that do, I don't. Indian Gaming School, thank you so much. Best luck and best wishes for you too. Okay. Yvonne, hi, Miss Nurse Savvy. I hear rumors between nurses and the ones being talked about are some of the sweetest nurses. There are definitely cliques here at the nursing home. So, what I will say, Yvonne, it is definitely cliques. It's cliques everywhere you go, and it's unfortunate, but it's a given. I mean, you're gonna click up with people, and it's not really you clicking up with them, it's just you get cool with somebody. When they feel like you're a cool person, they want to take lunch with you. Some people want to hang out with you after work. People are trying to do that with me in my current role, and I'm like, I joke around a lot, so they don't take it to heart, but I'll say, I'm not about to do nothing with y'all after work. We can do something here. We can go out to eat here. We can order in here, but after work is for my husband and my daughter. After work is for family time. So, a lot of the time you spend so much time at work, you need to have time with family. If you want to do something with your coworkers, that's fine as well. But for me, currently I don't. I really don't. And I'm not really a homebody. I like to actually get out there, but time is precious when you have little ones. And my oldest two daughters, they're in college, but I still have this 6-year-old. So I want to make sure that I'm there for her, that we can go out and have fun things going on with us, as well as when my husband is off on whatever weekend that I'm off, we enjoy together. Because work will take all of your life, and just to get a couple dollars to pay for the home that you live in, or your apartment, or your condo, and it's like, dang, I'm not even spending time with my family because I'm out doing this and doing that. So no, I like to spend time with my family, and it's okay if you want to go out with your friends, especially if you're single. If you married, you shouldn't be hanging out like that unless your significant other doesn't mind or they're coming along with you, but don't leave priorities at home for going out with temporary people that may be in your life. Not saying that all coworkers are temporary, but a lot of them are. They're not going to always be there for you. Okay. Um, so yes, cliques is a must. It's always not a must, but cliques are always built, and the ones I don't care for is the nasty ones. I've seen nurse practitioners click up. I've seen nurses click up, CNAs, LPNs, doctors. It don't matter. Everybody clicks up. But if they're butt munches, you can have your click to yourself. Don't even talk to me because I don't have time. Okay. Let me see. I've experienced workplace bullying as a CNA. Tell me what happened with you as a CNA. I can't really pronounce. Is it Clarissa Explains It All? Like the show. I remember that. Tell me about your workplace bullying as a CNA. Who was it? Was it another CNA? Was it a nurse? Was it management? Give me some more detail. Okay, Amanda, I was in a nursing home to recover and noticed that some put a lot of the work on a certain nurse so they can stand and talk. You know what, Amanda? That happens. And I'm going to tell you one thing. When I did travel nursing, my first travel assignment, and I did case management. I didn't even do bedside. Case managers have a heavier caseload of patients, but we don't do bedside. So I could have 15, 20, 30 patients, right? So once these, and I was the first traveler there in that department. So once they found out, they started researching, oh, how much travel nurses make. Oh, it's an opening here. Oh, she makes that much. The amount they thought I made, I didn't make. When I renewed my contract, I made more than what they thought I made. But the fact of it is they figured that dollar amount was way more than what they made every paycheck because I was getting it every week. And they told their boss, she get paid more, give her more patients. I said, oh, that's how we doing it. And the crappy part is, and that wasn't really bullying to me. That was more so jealousy because I'm there to help you guys. I'm there to help you not split up this floor and take on more. I'm taking on the whole floor. So for them to be upset because they didn't dive out into travel nursing and they were jealous of what they thought I was getting, the managers went along with it. You know why? Because they wanted to please their staff. They were losing so many nurses. This was during the pandemic where people were not really trying to work in a hospital setting because they were afraid, especially as staff. Nobody wanted to work anymore. They were afraid. With case managers, we didn't have to interact with COVID patients. We can call them on their phone in their room. Now, if they were sedated, then we would talk to family members, or we would talk to the nurses if it was something that they needed to be done, but we didn't go in the rooms with them. So backtrack. The bosses, which 2 out of the 3 were brand new, they just got into their role less than a year, so they wanted to people please. And I got additional patients because I was the traveler. I was like, oh, okay, well, it is what it is. And I took care of them with ease, no problem, because I kept getting paid every Friday. That didn't stop. But it just shows like the jealousy that's out here. And for what? They have to pay travel nurses more money than staff to be enticing for them to come. If you're not paying a travel nurse to come to your hospital, you still gonna be short staffed. So it was actually a blessing to have more workers to come and help. I was the first one, but before I left, it was about 5 of us. And I was like a part of the welcoming committee where I had like printouts of them to help them moving forward, that I have um, collected as I was there because I extended my contract. So I was there for like maybe 5 months because people started getting on my nerves too much. So I just had to go. I had to leave. But I was like in the welcoming travel girl, like, hey, this is what you need to help you. And they were like, oh my God, thank you so much. Nobody gave that to me, but I'm just a helpful type of person. And if you cool with me, I'm cool with you. But if you do stuff to bite me in the back, I'm gonna leave you alone and I'm not even gonna talk to you. But that's just the way it is with me. And it should be like that for everybody. Okay, let me see, what did I miss? Felt bad for her, wasn't in their clique. Okay. Um, Yvonne, I hate the gossip and drama in the workplace, so I decided to work in my own home care business. Now I don't have to worry about workplace drama. Good job, Carrie. That's awesome. Congratulations. Okay. Let me see. I just wanted to share an event in my life. Not sure if I should do so, but once my school organized sports event and my classmates didn't include me in their team because I was one of the silent kids. After that, one of the players in the team needed sports pants and I had one on. He asked me to borrow it, but I refused. After that, some strong guys came to me and ripped my pants on a. This is terrible. You know what? Is it Jeremiah? I cannot with people. Like, why would you want to take somebody else's clothing? You know, a bully is a bully, and you reap what you sow. So whatever they did to you is gonna come back to them 100-fold. I don't think that anybody should be bullied over anything, whether it's a workload, whether it's their clothing that somebody wanted to use. That's ridiculous. That sounds like, I think, wait a minute, did you tell me were you the one that was 16? Let me go back. Yes. Yeah, that sounds like some high school stuff where they trying to be funny. Um, yeah. I'm sorry you had to go through that. That's ridiculous. Okay, let me see. Yep, Amanda. Wow, that's crazy. Bullying, or I am being a weak man and just live with it. No, it's not necessarily that you being weak, but it's unfortunate that people will stoop that low to take something that they don't need. Um, and I mean, you can avoid it, but then when if people have an alternative ulterior motive to try to pick with you, it's like they're gonna continue to do it. So I don't know if you need to have like other friends around that have your back, or I don't know if you're afraid to stand up for yourself. They may be bigger, but I would try to avoid them as much as I can. I'm not saying run away when you see them, but like don't even be in their area. And hopefully they're done bothering you. Let me see. Yes, you're awesome and very nice. You actually care, and I'm the same way. People pleaser. Bless you. Thank you, Amanda. Anybody else want to share their workplace bullying stories? Feel free to comment in the chat. I will share. I will share a more so recent story that I had at my current job. And I mean, when you come to a job, you got to do your work. Like someone said in the comments, it's cliquish, and sometimes, the cliques are like the mean girls, or some of them are really nice and they just trying to really give you a feel for who you are to see if they want to interact with you. So when I first got there at my current role, and I never discuss where I work at when I'm currently working there because you never know who's watching you. And I already know a couple coworkers have said something to me about my channel, and I'm like, okay, I don't really talk about that at work, so just be quiet. But anyway, so as soon as I got at this job, I was placed and I'm not sure if everybody has heard this, but I'll give you a quick synopsis. I was placed in um, an area that I didn't apply for. If that has ever happened to you, where you applied for a job and they gave you a different role in a different area, comment in the chat. I'm not lying. I applied for an oncology role, and I did not get it. I was working on getting my OCN and getting chemo certified. And when you have those two that you're trying to get certifications for, it takes time. You have to have so many years with oncology patients, and with chemo certification, you have to have a minimal amount of, like, just the OCN, a minimal amount of hours with oncology patients, and then you study and you take a test for both, for different ones. For them taking me out of my current specialty that I was working in, it ruined for me getting my OCN and my chemo certification certificates to even sit to take the test. It ruined it, right? So, when I started, there was a manager that got me in, but some stuff happened and she moved. She actually transferred to a different state. So in that process of me being hired, it was a whole nother person that they wouldn't even factor in what I was hired for. I even had my paperwork that said it. They didn't care. They didn't care whatsoever. And I don't know if this has happened to anybody, but if so, put it in the comment. I was hired for something and was placed somewhere else. That was beyond me. I've never had that in my nursing career, in my healthcare career of 15, 16 years. I've been a nurse for 8, 9 years. I never. I was like, this is a bit shady. So, water splashing. So, when I came in, I didn't even know. I'm telling everybody, oh yeah, I'm in oncology, I'm doing this, I'm doing that, right? I didn't know until the day before I was getting out of orientation where I was going. Talk about communication skills. Poor. The person that made the judgment to get me to maneuver myself around to where I'm currently at didn't even come and talk to me for the first 2 months and say, oh, hey, my name is so-and-so. You're here because they cut that role, and I didn't want to just cut off the process. I just put you anywhere. Now, tell me in the comments, if this was you, would you like to be informed of everything? Because remember, I was travel nursing before this. So I could have extended my contract because the rate went up there. I could have extended my contract and continued to make my weekly checks. I could have went somewhere else as a travel nurse and continue to get money until the role became available, right? Please let me know in the comments if some shady stuff ever happened to you at work. And it's more so of like, you took all this time to get in here, and the place is a really good place. You want to advance yourself throughout the system, but it's like the way you got in was terrible. Let me look at these comments. Thank you, ma'am, for your kind words. Your first person I've talked to about this. God bless you. Oh, well, I'm glad you were able to open up to me, Jeremiah, and hopefully it doesn't happen again. I'm gonna keep you in my thoughts because you'll get through it 100%. I know you will. Okay, this happened to me a couple of times. Carrie, are you okay? I'm trying to remember when everybody writes on the video. If I'm not sure if you were the one to have your own home health care. Ooh, why am I tongue tied today? Home health care business, or was that someone else? I'm trying to look in the comments. 1 second. I can't find it. Okay, well, I'm not gonna look anymore. I thought the young lady that said she had her own home health business was Carrie, but maybe not. Okay, let me go all the way back down. I'm sorry, y'all. Let's see. Okay, most of the time in the workplace, most of the time bullying in the workplace is due to insecurities from the bully. 100%, Tiffany. 100%. Say it again. It is 100% the bully's insecurities. Let's see. Yes, they should have talked with you first. That's not right. Yes. Oh, okay, Carrie. Cool. It was you. Okay, so Carrie, tell me. You said it happened to you a couple of times. So was it okay? Because I know I said a couple of things. So this happening to you a couple of times. Was it you started working, or you applied for something for the job and they put you somewhere else? Is that what you're talking about? If so, tell me maybe a quick story of how it happened. But yeah, so Tiffany, you hit it on the nail on the head, because a lot of people that are unhappy with themselves want people to be unhappy with them. So they'll find something to, antagonize you and just nitpick just because. So, yes, to extend my story, I was placed in a place that I didn't want, and I was already there. So the manager said to me, well, yeah, I didn't want to cut you off from being in the process of working here, so we just kind of put you in an open position. And I assumed it was okay, but you can move around. You don't have to stay here. So, of course, I know I can move around in any hospital, but the common courtesy would be, hey, this role is being cut due to whatever. Would you still like to continue this process? If not, we'll keep your resume for when it opens up, because the role that I applied for did open up after about 6 months of me being there. So it did open up. But then it's like, it's too late. I'm already here. And then they added an additional a weekend rotation, which that wasn't on there originally. So they're trying to do extra stuff, and I wasn't for it. So I'm like, okay, I'm good. But that has never happened to me where I applied for something. When I applied for something, a certain role, I usually get it. I'm never thrown in something that I had nothing to do with, didn't even want, and didn't even have an option, because I showed all of my paperwork, and still, nope, you're going to go to this place because that's not available anymore. Excuse me? And it makes you seem like you're being, how can I put this? It makes you seem like you're being mm, a bit over the top, or you're being non-compliant, or you're just being an irate employee when you're upset about them swindling you, or throwing you into a role that you didn't want. And now what you do is, okay, you want to stay at this place. You have benefits everywhere. You have so many, and I'm not going to say too much so you don't know where I work at, because there's some things this place gives that other hospitals don't. But you have all of these different little things, and they'll pay for your masters. And like I've said in other videos, I'm gonna go back for my masters next year, and I would prefer for the hospital to pay for it. I mean, why not? I mean, I went to school for my masters for NP at the beginning of the pandemic, and all of the NPs were losing their jobs. So I'm like, why would I go to school if people are losing their jobs, and I'm wasting my money to get into a role where I'm still going to work as a nurse because there's no NP jobs? That was my mindset back then. Things have changed. My behind going to get my master's next year, no doubt. No doubt. I'm not even going to wait, because I'm not comfortable with what I'm doing right now. As a nurse, I could do much more. Okay, let me see. Um, People in my work bully, gossip, and character assassinate. But most aren't toxic. They're just sometimes participating in toxic behavior. Okay. And I've gossiped before too. It ain't cool. It's not. You know what? Everybody has a little bit of gossip, but the bullying is terrible. Like, don't pick with somebody because they're doing something you don't like or they got something that you want. Because I didn't really get to the full bullying of my current role. I just told you the process. So let me finish these and then I'll keep going. Okay, I'm supposed to be a manager, but they kept hiring, then firing the managers they hired after me. Wait, I'm supposed to be a manager, but they kept hiring and then firing the managers they hired after me. I've asked why they haven't trained me yet and still hired other managers. They didn't have an answer, so I quit. I don't blame you. Don't play with me if I'm supposed to be in management. Why am I not trained? But you hiring other people. So are they setting you up for failure because you're not trained? And how many weeks, days, months were you there? And they were still hiring other managers, and you didn't have any training. Let me see. Ruffins, hello. Let me see. Sounds like a federal government employment. Wow, is that what they do there, DJ? Was it DJ or D Jenkin? Okay. It happens again at another place. I was told I was going to be a manager and then just threw me in and made me learn on my own. Didn't get the manager. See, you know what? Why mess with people? And what I've observed in a couple of hospitals, because I was in management myself, I was put in a role. I got a little bit of experience to run that because I was a supervisor for a dialysis clinic. So um, I had a little bit of experience to run it, not an efficient amount of experience. My boss, if you heard this story, just listen along. But my boss was currently pregnant, and this is when my husband and I used to go on cruises every year around his birthday because my birthday, everybody's birthday was around my birthday. So I didn't want to leave the kids without celebrating them. So we just celebrated his birthday and took a vacation, just me and him. So for this, when I got back from my cruise, I mean, it was mid cruise, but you know, when you have your cruise, you either just pay for the internet or your phone, and I wasn't about to have nobody bug me. So you could either send me a text message, you can go online, stuff like that. But I got back, right, to the US, and I got a message 2 days before I got back saying that my boss's water broke and nobody is there to manage the dialysis clinic. And I'm thinking, like, she still had more time. I wasn't fully trained to do any and everything. So when I got home, I immediately called the higher ups. I said, well, I wasn't fully trained. So can you partner me with someone to help me run this? You know, for the first week, had the higher up sitting there with me so that she could do stuff, but she didn't really show me what to do. The things that I wanted to learn how to do, I learned it on my own. I created a schedule for staff, and even my boss was trying to still work on maternity leave. I said, no, you can't do that. You're on paid maternity leave. I'll figure it out. So I will make a schedule for the patients. I will make a schedule for staff. You know, I will get the call-ins, which I always got the call-ins. If it was a problem with the water filters and things of that sort, I shared an office with the gentleman that took care of all of that. But it was just like a big kick in the face because everything was immediately thrown to me and I only had 25% training. And I ran that thing like never before. The person that helped me the most was the social worker. So we ran it. Okay, if it was somebody that needed to come in early, you know, she would reach out to me. Okay, well, we got an open spot. Tell them to come in at 6 o'clock that day. Or this so and so is in the hospital, so they won't be into treatment. They can come in on that time. We ran it like this, and we still cool to this day. I was trying to get her to do um, some travel jobs as a social worker because they have travel social work jobs. And I don't know if she's still at that clinic, but I was trying to get her out of there. She went back to school, I think, to get her sports medicine degree. So hopefully she's done now and she's out of that clinic. But she was just comfortable there, and it's okay. Okay. Let's see. That is why I started my own business. I know my Carrie say that. Know your worth. Cause okay, so what I did was, and I've said this pretty much on every live. It's a reason why I went back to staff. My husband and I are trying to do something, and it requires for me to have a stable income. So I can't go back to travel and live my best life because I loved it. I mean, I would work 3 months, take a month off in between, or take the whole summer off. And I had so much money saved, I could do that. But it's like I'm dealing with this job that I'm at, and it's like I'm so used to just being done with people after 3 months, and I gotta keep dealing with them because I need what I need. So hopefully, oh, and then with the travel nursing, you know, I was able to create a couple of businesses. My husband and I have a peer space where we have, um, you know, clients to come in to do podcasts or to do photography and things of that sort. And then my online scrub business. So most of the scrubs that you see me wearing when I'm doing this video is my scrubs. So that money that I used, I mean, that money that I've gained from travel nursing, I put it into a business. So I'm literally my own billboard walking around the hospital, and you know, people are obtaining scrubs from me. Of course, I send them to my website, but the people that know me, I'm like, okay, well, you know, they'll ask what size, and I'll say, oh yeah, I have this, I have that. Or if I have a new color coming, hey, I got some pink ones coming. It's only gonna be limited. So, you know, they're on the lookout. But you definitely need to work for yourself. Absolutely. And then, you know, with YouTube is something that is another gateway of having your own extra income on the side. You know, and oh, I want to talk about something. I'm a wait. I want to talk about, somebody remind me in the chat, talk about a family member that reached out to me. Please, we got to talk about this. I cannot forget that. Somebody remind me in a couple of minutes, because we got to talk about that. Okay. I don't know how to pronounce. Is it honeydew? Honeydew love it? Is that it? Y'all so creative on how to spell these channel names. I love your channel. You are a big inspiration for me. I'm sure plenty others. Oh, continue blessings. Thank you so much. Let me see. You know what? So give me 1 second, guys, because I left something in the other room. Do not go away. I will be right back. Right back. And if y'all have any comments or questions, put them in the chat. Okay, I'm back, y'all. Okay, let's see. All right, so the true bullying of my recent job is I came in this area that I didn't want to be in. I was ticked off, of course, but I'm going with the flow, right? The person in that office with me, actually the two people in that office with me, they weren't helpful at all. I got my week's worth of training, 1 week worth of training from a different department. And the two young ladies that's in the office that I currently share were, one was like, oh, I only do this, and not helpful at all. I literally had to just reach out to the providers, and then the schedulers to see how things flow. So that right there, I'm like, okay, I see how you gonna be. So don't come for me for help, because I'm a very helpful person. But if you're trying to hold off on things, then we can keep it that way. Um, and then there was another nurse that was in the office that started 2 weeks before me, and she, my dog barking, of course, somebody driving past. Sorry, y'all. So she started 2 weeks before me, and she came in like she was just extra tough. Ain't nobody gonna mess with her type deal. And I didn't know any of this because this was before I started. You know, she was going on trying to find her own little space, her own little office. And where I'm currently at, it's a big room, but it's split. Nobody has their own office unless you're a doctor that's been there for a long time, or maybe a manager, but you're not getting your own office. They divvying that up, okay? And it's been like that in a lot of hospitals. If it's one room that they could split or put 3 people in, or 4, they gonna maximize their space and sardine can you in that. So the nurse that was walking around like, oh, I'm big, I'm bad, I can do whatever. She wanted my desk. She wanted where I was sitting at. And the unfortunate thing is, she asked me for my desk before I even met her. The person that trained her, I sat with, and she sent a message over and was like, have her to call me. So I called, hello, how are you? She's, giving me this whole spiel. I'm this, I'm that, I'm doing this. I have a new program that I'm in, blah, blah, blah. My patients are on a whole nother floor, but you sit in the office on a different floor and you have no patients. So she wanted my desk because it was bigger. And the desk that she was sitting at was, okay, so let's say, oh, this is a vertical. So let's say that her desk was this. My desk was this, if that makes sense. And she wanted it. She wanted it, and when we were on the phone, she asked, oh yeah, this was the original nurse for the department that you're in, but I'm already here and I have everything set up, so I just wanted to know it was okay for me to stay here. I said, no, if that's the original nurse's desk for the role that I'm in, then I wanted to stay that way. So she was upset, and oh, awesome, I pronounced it correctly. Honeydew. Okay. But yeah, so she was upset that I didn't give her that opportunity to take over the desk that wasn't hers. So she would pick with me. And what I did, and if anybody picks with you, get a notebook, get a pen, write it down. Okay. Date and time when. This lady picked with me for months. Okay. Months. And if I was weak-willed, I would have left. But I have a goal on why I'm there, and she ain't getting me out of that goal, because she's insignificant to what I have already in my mind on what to do. So people like that come around you, blow them off. But if they keep coming at you and you've already talked to them about, look, you need to chill out, let's have this conversation to get it over with. If nothing changes, you need to go to management and say, look, on this day this happened, on this day that happened, on this day we had to talk about this, and on that day they did this. You shouldn't have 3-4 different times where this person is bothering you, right? This is bullying. This is intimidation. She was trying to do all of this stuff, and then, this room that we shared was an ice box. So I brought my heater in there. So, by me putting a heater on my ankles, I didn't want it on the desk because I didn't want it to blow out and just be rude. I put it on my ankles. This woman said, oh, can you cut your heat off? It's getting hot. I said, get a fan. Because at that point, you picking will be so much, I'm not even my sweet self anymore, right? I am irritated with you even talking to me about me being comfortable in this area that I'm stuck in that I didn't even want. Those two, they had roles that they came into that they already wanted. Me, I did not. I was just tossed somewhere. So, she would continue to pick. It was somebody that came in that moved all of her stuff and rerouted it to the smaller desk. That came in and said, "Oh, how are things?" And she would say, "Oh, well, everything is fine, but I'm hot over here and she's cold over there." Looking like what that has to do with what he's saying about your equipment that he fixed up for you. Stop putting your problems on what you want from me. Then the last straw. And those little things are insignificant, but when you continue to pick about the same stuff because somebody wants something that you have, I'm like, okay, you're not going to get her over this. You acting childish. So I'm going to ignore you. So then the last straw, we had a meeting, right? We had a what do you call it? A staff meeting. We had a staff meeting. So at the end of the meeting, because I mentioned something, I mentioned this. I said, you know what? This place is stressful. I said, I've never worked a place where I had to pray every morning before coming in. This place is something else, right? So at the end of the meeting, because people agreed with me, yeah, because it was four of us that it was three of us that started around the same time frame. Actually, four started around the same time frame within 2 weeks, and 3 out of the 4 people agreed with me on how this was working and how it was going. So, as I said that, I didn't care. I just said it to them. I'm talking to the manager. So I'm leaving out, and the nurse that was bothering me, she walked up to me, touched me on my shoulder, touched me. First of all, I don't like you. So you touching me now? So she comes up, touches me, and then whispers in my ear, "Are you the reason why I pray in the morning?" She said to me, "Are you the reason, or am I the reason why you pray before coming to work?" The audacity for her to come up and talk to me, touch me, by the way, when I don't mess with you. Because you have that mentality of nitpicking. You're bullying and you're whispering something in my ear. You that close to me when I don't like you. I don't mess with you. We've had a discussion of our workplace relationship is going to be a good morning, have a good day. Because I'm sweet with everybody else. We cool. We doing stuff for each other's birthdays around the hospital. But you've already rubbed me wrong 4 times. So this had happened. And as I'm walking out, I immediately got loud. I said, "Please don't touch me. That makes me feel uncomfortable." I said it loud enough for other people to hear it. We're not about to whisper. You about to get up off me, and I want my boss to hear it. So when I said that, another person, and I believe I heard it, I turned around when she did it. I turned around and looked. Other people saw it. The people in the office on the other side of where we were heard it. "Don't touch me. I feel uncomfortable." You know what my boss said? Noah, yes, it was. You know what my boss said? I'm going to act like I didn't hear that. "Are you kidding me? It's okay." Because when I filed this report of me being bullied multiple times, and I have the dates and the times written down, you going to hear it again. Yes, you ain't about to just sweep that under the rug. You're not dealing with this. So if you want to keep me as an employee, you need to listen to me, and you need to get that one up off my back. Because to be honest, she had no reason to be in that room, in that office when her patients was 2 floors up. Why are you even there? So after I wrote up an incident about it to all three of the managers, including their higher up, they removed her from the office. It shouldn't have even took that long because I told somebody about it beforehand. And they just listened. It went out another year. I'm like, okay. I had a conversation with this lady. Nothing changed. It got worse. So now you coming up talking and touching on me. We're not going to do that. So either y'all do something about her or I'm going to leave. So they did something about her because they needed me to stay. So that right there, I just said a little bit of what happened in my recent role with my workplace bullying, because it happens to the best of us. Sometimes it's the sweet people, sometimes it's the ones that's butt munches. They get it right back. But when you do that to me, I don't mess with you no more. And if you keep messing with me, I'm gonna put it up in an email and it's gonna go to management, because I don't want nobody coming at me like, why are you yelling and why are you upset? I talked to you about it. Nothing was done. It's continuing. So these are the dates and times. I'm sending it off to y'all. Y'all handle it before I quit. Because a nurse can go wherever they need to go. I got a license in 2 different states. So I can go in another role. I can go back to traveling. But I'm choosing to stay here and tough it out because I have a goal. Okay, let me get to the comments. I had to get that out, y'all. I had to get that out. I still do have a story about a family member that reached out to me on this channel. I'm not letting that one go yet. I'm going to tell y'all about it. I just want to get back to the comments. Okay, jealousy is a big trigger for those bullies. Yes. Nothing like the power of a pen. Look, trying to work it out, say it again. You have to write down this stuff. Our memory is not going to always remember the date and the time of when this stuff happened. I literally have a notebook of all of this mess. And she came up and whispered in my ear, touching me on my shoulder. Yes. And it may seem like, and let me get down to the bottom of what did they do. If y'all want to know what they did in my situation, the full thing, comment. Put something in the chat if you want to know what they truly did in my scenario. Let me get back to these comments though. Okay. Let's see. Lofi Chu. Hello. Sky Boss. Thank you so much. Let me see. I have my own space at work, and my provider had an electric blood pressure cuff, pulse ox, and thermometer. The others took my machine while I was on break. When I returned, I overheard them mimicking when I was with my patients. You know what? People so childish. I mean, either we gonna work together or we not. Either we gonna joke together or we not. But to be mimicking somebody, oh, they want to be like you then, Carrie. That's okay. And look, you a boss because you got your own thing. So it's unfortunate that you have to deal with stuff like that, because people just don't care anymore. They really don't. They really don't. They do what they want to do. Uh-oh. Oh, Lord. Hold on. I think my video froze, y'all. Okay, y'all, what I'm going to do, I'm going to end this. I'm going to end this live, and I'm going to redo it. Okay? So be on the lookout. I'm about to reset this live and do a part 2, okay?